Okay. Good evening. We ready? Hi, I'm Luis Wilmot, Assistant Director of Public Health for Corpus Christi and Oasis County. We're going to give you a quick update on our current COVID-19 situation in the Corpus Christi and Oasis County area. So first slide, Omicron continues to be a variant of concern, so we are tracking this variant very closely. We got a lot of information to go over regarding the case counts and hospitalizations, so we'll get to that quickly. Just to let you know, as of January 31st, we've had a total of 54 positive cases of Omicron identified in the area of Nueces County. This type of testing takes a lot longer to get the results, so we are still collecting those as they come back. We only send about 5% of what we collected. Other places are also sending off some of their own, 5% of what they gather of their positives. So as we get those confirmations, we'll inform the public. The first Omicron case was actually collected on December 14th, so we know it was here prior to actually getting our first confirmed case. We are seeing that the vaccines and the boosters are continuing to be effective against this variant. So we'll get into how we're going to continue pushing those vaccinations to our community. We know that the Omicron is significantly more contagious than the previous Delta variant, with a lesser disease process for some, especially the vaccinated. So again, we will talk more about that in a moment. Just to be clear, that Omicron currently consists of 99.9% of all cases of COVID cases in the United States. So if you're getting sick right now with COVID, the odds are that you likely have the Omicron. On January 20th, we had the highest amount of cases in one single day, over 1,581 cases, actually 1,581 cases in one single day, so that was very concerning. As of the month of December of 2021, we were averaging only roughly about 65 cases of COVID a day. For the month of January, that changed significantly. We're up to averaging 739 cases a day, so very concerning, and that's why we put a lot of effort in trying to stop the spread of this Omicron variant. Next slide, please. As you can see here, this huge bar graph on the very end here, that's the number of cases for the month of January. We have over 23,000 cases for the month of January alone. If you compare it to the previous peak for the Delta wave in August, that had about roughly 12,000 cases. And you can see the previous peaks as well, a high of 55 and a high of 9,900 for the Delta variant and the Alpha, which was the original. So a lot more cases in a single month, a lot more contagious, a lot faster in which the manner of this variant was spread. Next slide. Here's a little good sign. This is the daily case count, not daily, but the weekly case count of Omicron. As you can see, we went from 300 cases previously, pretty steady at 300 cases for the month of October and November. The last time we saw that was the week of December 20th. The following week of December 27th, we climbed up to 1,300 in that 1 week. And from that point on, it just consistently increased 5,500, 6,900 in a week. We have now peaked across the top of that Omicron for the week of January 10th. We're coming back down. I see that on January 24th for this past week, we had only 3,600 confirmed positives. That shows a almost 40% reduction from the previous week. However, we are still concerned that this Omicron variant is still out there, is still being spread quickly, and there's a lot of cases that are not being tested. Because some of the symptoms are a lot more mild. So I can tell you that, when folks have milder symptoms, they're less likely to go get seen at urgent care or go get tested. So we're more than likely there's a lot higher case count than what there is. But this is what we're tracking based on the state records and our own records here in Nueces County. Next slide. As you can see here, if you look at this pie graph of the amount of the folks who are actually getting sick, ages 0 through 30, it's the highest amount of COVID cases. That's roughly 60% of all the cases that we're seeing. I'm more particularly concerned about the ages 0 to 19. That is the highest pie chart there. It's 29%, and these are our children, right? So it's concerning because our children 0 to 5, ages 0 to 5 are not vaccinated. They're not eligible to be vaccinated. And our children ages 5 to 11 just started getting vaccinated not too long ago, so we still got to make sure they're complete. And they're not even eligible for boosters. So that tells you exactly who's getting sick. Next slide, please. For this month of January, we've had a total of 60 deaths. That's 60 too many. However, on the bright side, we had a case count of 23,000 for 60 deaths out of 23,000 cases that were identified. That's actually pretty good. Previously, if compare it to the month of August and September, this is the peak of about 12,000 cases for Delta. And in the month of August alone, we had 154 deaths, and then the next month of September, we had 180 deaths. So Delta was a lot more deadly as compared to Omicron. Omicron seems to be just a lot more contagious, less deadly, less serious concerns about it, less disease process about it. Next slide. This is our current hospitalizations in ICU. This still is continuing to tick up. We are monitoring this closely because with our case count starting to come down a little bit, the less deaths, the less severity, why do we have an increase in our hospitalizations? Same thing for ICU. Now, it hasn't shown an exponential jump. However, it's still on the wrong track. We want to see this come down. So again, we're still implementing our COVID emergency response operations as far as continued vaccinations, continuing our COVID testing, getting folks to isolate and quarantine, identify it early, intervene early so we stop the spread so quickly, especially to the most vulnerable. Next slide, please. Our COVID testing that's being conducted is giving us a positivity rate so that we can kind of gauge what's happening in the community. Currently, we're averaging around 49 to 50%. So almost half of the folks that come in through our testing is going to test positive. Recently, in the past 2 days, I did see a decrease of about 35% in one day, but we're back into the 40s the next day. So we're going to continue to average those out for you to see if there's a steady decline in the positivity rate. But right now, we're averaging about 50%. So half of the folks that are sick and getting tested are coming up positive. So what do you do if you're positive? So current CDC guidelines, if you do test positive, you're supposed to isolate for 5 days. Isolate from yourself, from your family members, from friends. Keep it to yourself. You wash your hands often, clean commonly used areas often. And if your symptoms resolve within 5 days, you can leave your home wearing a mask. If you still have fever, you're not supposed to leave your home. Fever is the most important symptom there. That's really telling us that you're more contagious. So get better. Once you get better, you may leave your home. 5 days with a mask, 5 days isolated at home, then you can leave after the 5 days. Now, again, if you're still sick, you stay home and get better, and then you can finally leave. If you have been exposed to a positive, and you are fully vaccinated, fully boosted, up to date on your vaccines, or you've had COVID in the past 90 days, okay, you are allowed to wear a mask around others for 10 days. You don't necessarily have to isolate, you don't have to quarantine. You're welcome to continue working because you have that protection in place. Now, if you develop symptoms, then that's where you need to get back home, get tested, and see if you are positive, and then we'll take it from there. Versus if you're positive, you could follow the other criteria that's on the left-hand side here. If you're exposed and you're unvaccinated, unboosted, and you're not up to date, then the right answer is you stay home. You stay home for 5 days, stay clear from everywhere else, wear your mask. Once 5 days has passed, then you can leave your home wearing a mask as well. In the event that you develop symptoms, we ask you to get tested about day 5 after your exposure, because it's taken 3 to 5 days of an incubation period to test positive. If you test positive the next day after being exposed to a positive, you can come up negative and give you a false sense that you're not positive. So then later on you'll develop symptoms and now you're officially positive. So wait 5 days and then you can test yourself. Our next slide. So this is our vaccine breakthrough cases. Obviously, we have a lot more folks that are vaccinated now, so we're seeing more folks with vaccine breakthrough cases. Sorry. Now, these cases are identified when we conduct our contact tracing. So that's the only way we have of saying, okay, I've talked to this person, they're a positive. We ask those important questions. Were you vaccinated? What are the dates you're vaccinated? Were you boosted? So now we can tell you, hey, this was truly a vaccinated case based on the definition by the CDC, or it's not. The amount of folks, so today we have 12,917 cases that have been considered vaccine breakthrough. And most of them were collected in this past month of January. There's been 377 folks hospitalized that were vaccine breakthrough cases, and of those, we've had 97 deaths. Next slide. This is just a graph kind of just showing our vaccine breakthrough cases as they're coming in. Like I said, it's not somebody telling us, hey, you have these cases. It's our folks putting in the hard work, the long hours, calling these folks at home saying, hey, you've been identified as a positive. And then we have a series of questions that we can ask them, make sure they're quarantined, they're taking the right steps per the CDC guidelines. And as you can see, these are being identified, and we have more. We have a lot more cases now, so we'll continue contact tracing and making sure that the residents have the up-to-date information per CDC guidelines. So adults who are unvaccinated had about a 5-time higher risk of infection compared to adults who were fully vaccinated with a booster. So, we talk about these vaccine breakthrough cases, and you might think, well, why get vaccinated if people are still getting sick? And this is why, right? The CDC is saying that you are 5 times more likely to get infected if you are unvaccinated. And God forbid you have a comorbidity that increases your risk factors, and you end up hospitalized, or God forbid a death. Next slide. So we will continue to push a lot of our vaccinations, or make them readily available to the community. The health district has performed over 205,000 vaccinations, so a tremendous job there by the staff at the health district. We personally have given over 29,000 booster injections, but I was pleased to see that in Nueces County, per the state records, we have over 78,900 residents who have received their boosters. So the word is getting out. People are doing the right thing. Get yourself vaccinated and get yourself boosted. Next slide. Our current vaccination rates for Nueces County, for the total population, we're about 55.6%. Again, we just started vaccinating our folks, our ages 5 and above, not too long ago. So if you take that eligible population, we're about 59% ages 5 and above. As you can see, 12 and 16, we're about 65%. And again, our elders are leading the way. At 65 above, they're at 80.4%. So this is a very busy slide. Bottom line is, what I want you to know is, if you're looking at, if you're concerned about what vaccine you should take, when you're due, what you're supposed to get, all of our health district sites out there are ready and to help you out and help you make that best decision of when you're eligible for your vaccination. This chart simply tells you, hey, you're 5 and above, you're eligible for a Pfizer vaccine, only the first 2 doses. Ages 5 to 11 are not eligible for a booster, but they are eligible for an additional dose. So in the event that person is immunocompromised or has a weakened immune system, they are eligible for an additional dose 28 days after they finish their series, the first 2 series. Ages 12 to 17, also eligible for Pfizer. Same as an adult, first two series, 21 days apart. They're eligible for their booster 5 months later. 18 and above for Pfizer, eligible for booster 5 months later, as well as Moderna. Moderna also has, both Pfizer have that 28-day additional dose if you're immunocompromised. And of course, Johnson & Johnson, you're eligible for a booster 2 months after their first injection. So we do have multiple indoor COVID vaccination sites available for the community to utilize. We've gone over these before, but La Palmera Mall is still open during mall hours. The Greenwood Senior Center open daily from 8 to 5. The outlet mall in Robstown, the outlets in Robstown also available Monday through Saturday from 11 to 6. We have a relatively new site, the Hilltop Community Center in Annabelle. That's open Monday through Saturday from 12 to 7. And we are both here in the county courthouse and the city hall, Monday through Friday from 8 to 4, so that folks coming in to the city hall and the courthouse can get taken care of as well. Our outdoor vaccination sites, we have 3 sites that we're constantly out there, providing vaccines. The QSR Legacy Center down South Staples from on Monday through Thursday, 11 to 6. We're out there at Falla's parking lot on SBID in the Flower Bluff area, Mondays and Wednesdays from 10 to 5, and the Goodwill store on Ayers, Tuesdays and Thursdays from 10 to 5 as well. There is a concern about the weather that's coming in this Thursday, Friday, and Saturday. As of right now, we are still planning on being there for vaccinations on Thursday in the event that there's some significant change to the forecasted weather that we're unable to provide vaccines safely to the community, we will shut those two down on Thursdays at the QSR and the Goodwill clearance store. However, they're still slated to be open this Thursday as of right now. We have our vaccination clinics at the schools. I'm happy to report that they've been very successful. So we've made vaccines readily available to parents who might not have had the opportunity to take their children to one of our sites or take them to their primary care for a vaccine. So a lot of parents and children are being able to take advantage of us being at the schools. We thank CCISD for working with us and allowing us to be in the school and make sure that their students are vaccinated. So this is a breakdown of where we're going to be. Typically, we're staying there only from 3 to 6 in the afternoon. The mornings seem to be too busy with parents dropping off the children, but in the afternoon, the parents are willing to stay there and get their kids vaccinated. So here's the following. You can see these on our website at cctexas.com. Our COVID testing. So as of right now, we will be collecting samples at the old Christmas Spawn Memorial Hospital parking lot this week through Thursday. Again, pending any inclement weather that shuts us down, we are expected to be there on Thursday. We will be closed on Friday and Saturday. The Amistad Community Health Clinic here in Robstown and in Corpus Christi are also available through appointment process. So you can reach out to the numbers here that are listed, and you can schedule your vaccination through them as well. So you've heard recently that the Biden administration has offered free COVID at-home tests for the community. So as currently right now, every home in the United States is eligible to order 4 free at-home COVID tests. They're completely free. These tests will arrive typically between 7 to 12 days after you order them. This is a rapid antigen test. This is not a PCR. There's a key difference. The PCR is the gold standard to identify COVID-19. The rapid antigen is not, but it does help to give you an idea if you're positive and you need to take further action. You can visit these websites that are listed, www.covidtest.gov or www.special.usps.com to order your at-home test. What we do ask the community is that if you do take an at-home test, that you report it. And we've made it relatively easy for you to report your positive results. So if you test positive with any at-home tests, you can go to the Corpus Christi website at cctexas.com, and there is a link, a button that says Submit an at-home COVID-19 test result. Once you select that button, you'll be asked to give your information. Probably take you less than a minute to fill out the questions. You submit it, and the Public Health District will get that information, and we'll be able to count that as a suspected case in our case counts. They're also offering free masks. So they are available at some participating pharmacies throughout the area. H-E-B, Walmart, Sam's Club, Walgreens, CVS. I would call probably prior to going in case they run out of stock, but there are free masks available to the residents. And that's all I have for you today. I'll be followed by Dr. Bird.
Al 31 de enero se han confirmado 54 casos positivos de la variante Omicron. Las vacunas, especialmente los refuerzos, continúan ofreciendo protección. Omicron es significativamente más contagioso que la variante Delta. El 20 de enero se reportaron 1,581 casos, siendo este el día con la cifra más alta de casos positivos confirmados en el condado de Nueces. En lo que va del mes de enero, son 23,025 casos positivos al virus. En la última semana de enero se registraron 3,607 casos. El grupo de personas con mayor número de casos se encuentra entre los 0 a los 30 años, posiblemente debido a la elegibilidad de la vacuna, sobre todo niños menores a los 5 años. El total de fallecimientos a la fecha es de 1,372 en el condado de Nueces. Actualmente se encuentran 241 personas hospitalizadas, 58 de ellos en unidades de cuidados intensivos. Las recomendaciones de los Centros de Control de Enfermedades indican que si usted resulta positivo a COVID, debe aislarse por 5 días. Si sus síntomas ya han desaparecido, puede salir de su hogar utilizando un cubrebocas por 5 días adicionales, a menos de que aún cuente con fiebre. Si ha estado expuesto a alguien con COVID y está vacunado, se le pide usar cubrebocas por 10 días, pero si no está vacunado, entonces se le pide aislarse por 5 días y usar cubrebocas por 5 días adicionales. Si cuenta con síntomas, tómese la prueba para determinar si cuenta con el virus. Durante la presencia de Omicron, las vacunas han provisto con protección al virus. Los adultos quienes no recibieron su vacuna son 5 veces más propensos a infección que aquellos quienes sí están vacunados. Esto de acuerdo a los Centros para el Control de Enfermedades. Las vacunas de refuerzo pueden ser de diferente farmacéutica dependiendo de la vacuna original que usted recibió. Las clínicas de vacunación continúan ofreciéndose en el Centro Comercial La Palmera, el Centro de Adultos Greenwood, los outlets en Robstown, el Centro Comunitario Hilltop en Annabelle, la Casa de Corte del Condado de Nueces y aquí mismo en el Ayuntamiento. Otras escuelas también están ofreciendo clínicas de vacunación y para esta lista y los horarios se le pide acudir a la página www.cctexas.com/clinics. La clínica de pruebas para determinar si cuenta con el virus continúa en el antiguo Hospital Memorial, ubicado en el 2606 de Hospital Boulevard. El último día de esta semana es mañana, el día de mañana de 9 a 3. Este va a estar cerrado el día viernes y el sábado debido al clima. También la Clínica Amistad aquí en la ciudad y en Robstown ofrecen la prueba, pero solamente atienden con cita. Los kits de prueba caseras también están disponibles para cada una de las residencias en los Estados Unidos. Esta prueba es de antígenos y no PCR. Visite www.covidtest.gov o www.special.usps.com para llenar una solicitud. Cada dirección puede recibir hasta 4 pruebas gratis. Si obtiene un resultado positivo con cualquier prueba casera, se le pide reportarlo al Distrito de Salud Pública visitando www.cctexas.com y haga clic en Submit at Home COVID-19 Test Results. También hay cubrebocas gratuitos disponibles en algunas farmacias participantes como H-E-B, Walmart, Sam's Club, Walgreens y CVS.
All right, thank you. My name is Dr. Chris Bird. I'm here to speak to you on behalf of the Texas A&M University Corpus Christi Informatics and Modeling team, and this is your weekly pandemic report. We have 2 objectives on the modeling team. 1 is to address your concerns and questions, and 2 is to enable evidence-based decision-making on behalf of our local leaders. And we'll get right into it with the cases. As you could see from the picture of Nueces, now we're looking at the picture of the Coastal Bend. The cases, which are the black dots, are dropping faster than our projections predicted, so that's a good thing. The cases are dropping off. They're all the way down to 500 to 600 cases per day, which is still a lot of cases per day, so this is by no means over yet. We're still in the middle of this Omicron wave. The lines are the 2 different projection scenarios. The red line represents what would have happened if we had just let it rip and not wore masks and not did anything to try to slow down the Omicron curve. And the gold line is the one where we behave the way that we have during past curves and try to slow things down with COVID and wear masks and social distance, do your curbside pickups and the like. And you can see that the data most closely follows the curve where we're doing things to slow down COVID. And so this shows that we can have an effect on the outcome of these COVID surges. So cases are dropping faster than we predicted, and that's good. Unfortunately, the cases have continued to increase. The hospitalizations have continued to increase past the time when we projected that was going to occur. It's a little bit past there, but they are now just starting to come down over the past couple days. That peak was a little bit higher than what we predicted for the number of people going to the hospital overall. But the real change from last week was this huge increase in the number of people with COVID in the ICU. There's a 61% increase over last week, the number of people in the ICU with COVID. And when you look at the black dots, you can see that they're following the gold and red curves up, and they kind of level off for a couple weeks. And what we were hoping last week, where it still looked level, was that this was the model over projecting where the cases or where the ICUs would go, and it would remain low. But unfortunately, in the last week, it jumped up and went past where our projections were predicting the peak would be. We think that this is right at the peak now, and this should start to drop. Hopefully in the next couple days. Realize this data is current up through January 31st, and we're already a couple days into February here, so hopefully it's already started to come down. What does this look like in terms of last week versus this week? This is a graphic that shows you the proportion of people in the ICU with COVID in red and without COVID in blue. And if you look right here, this is Corpus Christi, where I'm flashing the box. Last week, this week. See how big that jump is? We went from about a quarter to almost a half of all the people in the ICU having COVID. And so this graph represents very intuitively the pressure that an ICU is feeling from COVID. And what you can see is that despite the fact that Omicron is much less virulent than Delta, there's still a lot of pressure on ICUs around Texas. If you look, you can see places where there's a substantial amount of pressure being exerted by COVID, and a lot of beds are being taken up. If we take the same graphic but spread it out across the whole pandemic, if you want to pause this and look at it and inspect, you can see where we're at relative to other peaks. But this week, in terms of people in the ICU, we surpassed the peak of winter 2021. So the Omicron peak has put more people, has had more people in the ICU at the peak with COVID than in the winter of 2021, but not quite as much as we've seen in the Delta peak or the original peak. Okay, and going on to fatalities, unfortunately the fatalities are increasing. I was kind of holding out hope. I haven't shown this projection yet for the whole Omicron curve. This is the first time I'm showing the fatality projection. I was hoping it would never increase to what was being projected, but now it's very clear that fatalities are increasing, and they are increasing approximately in line with the projection. So we're showing that. We don't expect them to go too much higher than they are now, but this would indicate that we're not quite at that peak yet, and fatalities would logically follow. The peak in fatalities would logically follow the peak in ICUs due to COVID, which we're at that right about now. Okay, the thing that really matters is how much vacancy are there in our hospitals in the Coastal Bend, and right now we're at about 2.9% ICU vacancy, which is low, but it's not zero, where we pretty much got there during the Delta peak. And the overall vacancy in our hospitals is about the same as it was last week at around 8%, 8.6% this week. And so what this means is that of the staffed beds, 8.6 of them are empty and ready for somebody to occupy them should they need that bed. So as long as we can maintain at least a few beds that are available, that should do us well. And we're right around at the peak, so we expect these numbers to start increasing from here forward. We expect there to be more vacancy moving forward. So in summary, the cases are declining. The hospitalizations are starting to decline. And they peaked in the last week or the last few days. The ICU hospitalizations are at their peak right around now, and they haven't quite started to decline in our data set. And the fatalities are probably at least a week away from their peak. The projected cases and hospitalizations are reduced by our behavior. The modeling is showing that if we did nothing, we would have seen a lot more people in the ICU. A lot more people in the hospital than we have, and so people at Coastal Bend should be commended for that. But I want to remind you that we're still in the middle of the Omicron peak, or I'm sorry, the Omicron curve, and just because the cases are going down doesn't mean, okay, we can take off our masks now and don't worry about it. If we do that, the numbers are going to go up again, and then we will not have seen the peak. So we want to keep putting in that effort. Going back to normal right now prolongs this wave. We want to have this wave done with as fast as we can. So we need to get those numbers down lower than 500 a day, 600 a day. They need to get down to like 5 or 6, or how about 0 a day? And then we can try to go back to normal. Hospital vacancy is low, and so that's going to affect morale in the hospital, the people that have been dealing with this for 2 years straight now. And the healthcare workers, they're strained and they're tired, and there's less of them now than there were in the past because people are quitting. Right now, people are going to more lucrative jobs that are offering higher pay in other locations. And just because this peak isn't as high as other peaks doesn't mean that we're seeing substantially less strain on our hospital system. There's less people working in the hospitals now. So that's something to remember. So we want to combat Omicron. We don't want to just let Omicron win. You can do that by avoiding. If you avoid, then you're less likely to be exposed to COVID. Masking. If you're exposed to COVID and it's around you, a mask is going to block it most of the time. 3, vaccination. If you get vaccinated and you do come in contact with COVID and it gets through your mask and you get infected, you're less likely to go to the hospital. You're less likely to die if you're vaccinated. Last, if you get sick, 1, get tested, see if you're positive with COVID or something else. If you're positive, isolate, and isolate till you get the result of that test, and that's going to reduce transmission. I know there's that complicated flow chart that I can't follow, so here I'm going to give you the simple guidelines on how to do the right thing with isolating and masking. If you are exposed to somebody with COVID or you test positive for COVID, isolate for 5 days. After 5 days, wear a mask. Otherwise, whenever you're out in public, wear a mask. It's simple, and you can't be in violation or go against those CDC rules if you follow those simple guidelines. So that's our report for this week. We'll go to a translation, and then if there's any questions, we'll kick it back to Luis Wilmot. Thank you.
Los casos positivos han estado disminuyendo más rápido de lo previsto. En la última semana, el aumento de casos fue del 61%. De acuerdo al censo de pacientes con COVID, este ha disminuido considerablemente en el área de la costa. Los casos de Omicron en las unidades de cuidados intensivos han sido mucho más altos que las cifras reportadas hace un año durante el invierno del 2021. Los hospitales del área reportan camas vacantes del 2.9% en las unidades de cuidados intensivos, mientras que las camas en áreas generales, las vacantes están en el 8.6%. Las hospitalizaciones generales han alcanzado su punto máximo. Hospitalizaciones en las unidades de cuidados intensivos están llegando a las cifras pico. Se reducen los casos y hospitalizaciones proyectadas mediante el uso de cubrebocas, evitando así la continua transmisión. La vacante hospitalaria es baja, mientras que los trabajadores de salud están ya tensos debido al trabajo interminable. Se les sigue aconsejando evitar las áreas con grandes concentraciones de gente, así reducirá la exposición al virus. El uso de cubrebocas reduce las infecciones. La vacunación reduce los síntomas graves. Esa protección se verá limitada contra infecciones sin vacunas de refuerzo. El aislamiento cuando esté enfermo y la toma de pruebas va a reducir significativamente la transmisión.
You have any questions? All right. You guys have a good night. Thank you.